All right, another health story that we're following, concerns about maternal mortality on a global scale. The number of women who die from childbirth has declined over the last 30 years. But here in the United States, the number has actually increased. In fact, 700 American women die each year from pregnancy complications. After looking at a decade's worth of research on the issue, a new report published in the Journal of Maternal, Fetal, and Neonatal Medicine is out with its findings on what has and has not worked. And joining us now is one of the authors of that report, the director of Global Women's Health at the NYU College of Global Public Health, Dr. Tara Shirazian. And I want to be clear with everybody here. You also have an organization called Saving Mothers, which I'm on the board of, and it is something that is incredibly close to my heart with all of this. But in this paper, you actually find that certain hospitals are actually working on eradicating maternal mortality, but you're finding more success at the local level in communities. Talk about that.
So it was actually really interesting. We set out to look at all the evidence that's been published in New York State on maternal mortality in the last 2 decades. What has worked, what has not worked, where do we need to go with this issue? Saving Mothers, SavingMothers.org, my NGO, has been spending the last 10 years looking at maternal mortality around the globe, but we really wanted to focus on New York. So what we found was that hospitals are doing some programs to reduce maternal mortality, and there are programs being done in the community as well, but they're not sort of linked up. So they're not offering us maximal benefits in terms of reduction of maternal mortality in New York. So we find these small programs in various places that are being done, but the rates of maternal mortality have not decreased in the last 20 years.
What have you learned about racial disparities between mothers who die while giving childbirth? I think that is a question on a lot of people's minds.
Yeah, it's a huge issue. We found that there's evidence that Black women die at roughly 12 times the rate of white women in New York City.
Unbelievable.
So, you know, in a city where we have so many resources, you know, around the globe, we really don't have that luxury in many places. We don't have resources. We don't have hospitals. This issue is extremely alarming here in the city. So I think really reaching out into the communities and understanding those issues, we actually learned that most of the women who died had received no prenatal care. So this means that these are women that are underserved out in the city that are not accessing health services. They're not getting prenatal care. They're not coming in for visits. They're not seeing their physicians. So why is that? There are multiple levels of reasons why that is.
So how do you change it?
Well, so we've started actually through Saving Mothers, a program that we call the Empower program. That program will both educate and empower pregnant women themselves. We're going to offer these kits where they have very specific health tools that will help them understand their complications in pregnancy. It also will focus on communicating with their doctors, how they communicate issues, how they talk to people about their problems and about their, their issues in pregnancy. And then also we'll empower the providers, so the community health workers. You know, there's a big push to have more doula services in this city. So that's great, but it needs to be paired with education. So what is the structure of that program and how are we measuring that program moving forward? So having more doulas is wonderful, but we need to measure it. Like what is the content of what we're, the program that we're giving those doulas.
Well, I will say, Saving Mothers and you guys are just doing such incredible work, and we appreciate the work that you're doing. So thank you so much for coming in so early.
Thank you. Yes.
Post New Year's Day.
Yeah, and I think everyone can be part of the solution. So please join us at SavingMothers.org. And
thank you, Tara, so much for your work. Appreciate it.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.